What's up, you guys? It's your boy Miguel giving your daily dose of radiation. Today's video, we're covering what is a typical day like for the patient outbuilding at a hospital. So I'm an Xray Tech, been doing it for 4 years, work a lot of overtime, so I dabble in the day shift. So our patient outbuilding is that's like part of the main hospital. It's one of the 3 branches of the radiology, X-ray department of ours. That one we have occasionally some patients will get scheduled in sometimes. It's mainly used for pre-op, post-op, just patients who just seen their PCP and be like, my knee hurts, and they kind of like, here's your order. Whenever you get a chance during X amount of hours, you can go to this department and get stuff done. For the most part, it's pretty easy. Sometimes we have a bunch of it depends on what day. Certain PCPs and certain specialists, doctors are like their days in the office are certain days, so the influx of certain exams will vary depending on what day and stuff. Some days it'll be like straight up just hips and spine because there's certain doctors who deal with that and they send them all. Other days it'll be a bunch of pre-ops. Usually it's Friday, slammed with a bunch of pre-ops. Those are just usually chest x-ray, sometimes 2 views. And then we have the post-operations, which usually those happen like during the week. Those are pretty simple. Occasionally we'll have the bilateral knees or something like kind of random, like a sinus, mandible, and random stuff like that. But for the most part, it's mainly chest x-rays, both scheduled and unscheduled. The only issue working over there you have to be on top of is how the exams are ordered, because not every single PCP knows how to order exams correctly. So sometimes you have to make sure consent signs are formed, make sure that you have to double check the orders to make sure they're right. Compared to like if you work in the emergency room or at the main, usually doctors know better how to order stuff, I guess, and you really don't have to check. I mean, you always have to check stuff like simple, like if it's left or right, same patient, this and that. Like there's basic stuff you'll always have to check too, but it's a little bit more harder or more steps in the patient outbuilding. They have a 30-minute lunch also, which usually a lot of our patients come during our typical lunch hour-ish, because usually most patients will go see their PCP or whatever stuff they got going on about 8 all the way to like 11, and then they all kind of shimmy to try to come and get their x-rays done before they have to go and eat their food or whatever. To have a lot of like heavy workflow is usually before 2 o'clock. After that, it kind of dies down, and you just have people who just randomly come in. It's usually at our department, it's just 2 x-ray techs over there holding it down. And we have like CAT scan and ultrasound over there, and the registration people. So you will have to be in contact with them, because they ask you sometimes, hey, they order this, do we do this? Or hey, is this a main kind of x-ray department type stuff? Yeah, it's me, where we go. See you on the next.